Welcome to my channel. Burning urination, or urine infection, is a very common problem. Both men and women can be affected by this problem, but women are more susceptible to being infected compared to men. When it comes to the discoloration of urine, or if there is increasing or decreasing urination, we often become concerned that we might have a urinary tract infection. In today's video, I will discuss with you the following topics. 1. Why does a urinary tract infection occur? Who is at the highest risk of getting a urinary tract infection? 2. What are the symptoms of a urinary tract infection? 3. How can we treat a urinary tract infection at home? 4. What measures can be taken to prevent urinary tract infections? To learn more about urinary tract infections, please watch the video until the end. Let's get started. When there is an infection in the urinary tract, it is called an UTI, urinary tract infection, in medical terms. Let's first learn about the different parts of our urinary tract. Look at the picture. The upper part of the image represents our two kidneys, and the lower part, resembling a balloon, represents the bladder. The two tubes coming from the kidneys and connecting to the bladder are called ureters. Through the process of urine production, the kidneys filter excess water, waste products, and various toxins from the blood and eliminate them from the body through urine. The ureters transport the urine directly from the kidneys to the bladder. The bladder then stores the urine. An adult can hold around 500 to 700 milliliters of urine in the bladder, although even when 200 to 350 milliliters of urine accumulate, we feel the need to urinate. The lower part in the image is the urethra, through which urine is expelled from the body. Urinary tract infections, UTIs, occur when the urethra, bladder, ureters, or kidneys get infected by microorganisms. In simpler terms, it is an infection in the urinary system, commonly known as a UTI. Now, let me explain who is more susceptible to UTIs, or at a higher risk of developing them. 1. It is advisable for adults to consume an average of 3 to 4 liters of water daily. If you drink less water than necessary, you may be at risk of developing a urinary tract infection. 2. Holding urine for a long time, or resisting the urge to urinate, can increase the pressure in your urinary tract, which can lead to an infection. 3. Individuals with weakened immune systems, such as those with diabetes or kidney disorders or pregnant women, are more prone to developing urinary tract infections. 4. Newly married couples may experience an increased risk of urinary tract infections. This condition is referred to as honeymoon cystitis by medical professionals. 5. Poor sexual hygiene can also contribute to urinary tract infections. Maintaining proper hygiene before and after sexual intercourse is important. 6. In comparison to men, women are more prone to urinary tract infections. This is because, firstly, women have a shorter distance between the urethra and the anus, making it easier for bacteria to enter the urinary tract. Secondly, the length of the urethra in women is much shorter than in boys. As a result, bacteria can easily invade the urinary bladder and cause an infection. Approximately 90% of urinary tract infections are caused by a bacterium called E. coli. Additionally, there can be other types of bacteria that can cause infection. What are the symptoms of a urinary tract infection? The symptoms depend on where the infection has occurred in your urinary tract. We will focus on the diagram of the urinary tract. The lowermost part is the urethra. If the infection starts in the urethra and does not extend to the bladder, then two symptoms can be observed. 1. Some discharge along with urine, and 2. A burning sensation during urination. If the infection spreads and affects the urinary bladder, it is called cystitis. The symptoms of cystitis include 1. A burning sensation during urination, 2. A frequent urge to urinate, 3. Lower abdominal pain, and 4. Changes in the color of urine, cloudy urine, and sometimes blood in the urine. If the infection reaches the kidneys, it is called pyelonephritis. The symptoms of pyelonephritis include 1. Shivering or fever, 2. Nausea or vomiting, and 3. Pain in the abdomen or back. By observing these symptoms, you can generally determine whether you have a urinary tract infection or not. In addition to that, you can confirm a urinary tract infection through the following tests. 1. Urine for IME, routine microscopical examination. In this test, various aspects are examined. However, if the report shows pus cells of 8 to 10 HPF or more, then it indicates that you have a urinary tract infection. This report shows pus cell 30-40 HPF, so it's definitely urinary tract infection. 2. Urine for CS culture. This test is performed by many doctors to determine the specific bacteria causing the infection, and to identify which antibiotic is needed to treat the infection. Now, let's discuss the treatment for urinary tract infections. If you believe that you have any of the mentioned symptoms, it is important to seek prompt medical advice, because urinary tract infections are bacterial infections and require the use of antibiotics. Your condition will be assessed, and based on the report, the doctor will prescribe antibiotics. Remember not to self-medicate with antibiotics purchased unnecessarily from pharmacies. It can be harmful. However, you can start with some home remedies. 1. Increase your water intake. You can consume at least 12 to 14 glasses of water per day. Along with water, you can have fruit juices, coconut water, etc. 2. Additionally, you can take a syrup that contains potassium citrate and citric acid, which can be found on the market under names like Citric-A, Ural-K, CK, etc. The recommended dosage is mixing 2 teaspoons of the syrup with a glass of water and taking it 3 times a day. This will help reduce the burning sensation during urination. Follow the advice of your doctor and take the prescribed antibiotic for 7 to 14 days. This will help alleviate the problem, inshallah. Please note that it is important to consult a healthcare professional for an accurate diagnosis and appropriate treatment. If there is a problem, many people experience recurring urinary tract infections after recovering from one infection. To protect yourself from urinary tract infections, you can follow these guidelines. 1. Drink 3 to 4 liters of water every day. 2. Empty your bladder immediately when you feel the urge to urinate, and avoid holding urine. Holding urine can lead to an infection. 3. Maintain proper hygiene before engaging in sexual intercourse. Always urinate after sexual intercourse. Urinating after sexual intercourse can be beneficial. 4. Avoid using any soaps, lotions, creams, or shampoos on your genitals. This can disrupt the pH balance and increase the risk of infection. Use only water for genital hygiene. 5. When using the toilet, wipe from front to back. Never wipe from back to front. Wiping from back to front can introduce bacteria from the anal region to the urethra, leading to an infection. 6. Avoid using sanitary pads for more than 6 hours during menstruation. Use breathable cotton underwear instead. 7. Avoid using scented products or body sprays on the genital area. By following these guidelines, we hope you will be able to protect yourself from urinary tract infections, inshallah. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Thank you for watching this video.